And I would reiterate my proposal: Health Central, an Adventist Health System hospital, separate license, separate board, separate medical staff accreditation, and assuming its assets, committing to $100 million, and not less than, that is, by the way. The ABDIT model drives more capital, then we'd put more in. And essentially we'd put on the Adventist Health System model a fence around Health Central for 5 years and keep all 70% of ABDIT here in order to hit that $100 million and beyond. And that has worked very well for us in our prior mergers. And after the 5 years, then Health Central would participate in the model I described, which has benefited all the hospitals in our company. And a local board, and obviously a focus on your vision. We see a major hub here, and we would want to bring the Florida Hospital brand strength to that hub and take this into an incredible future. So, Madam Chair, that is all I have, and if there's time, we will take some questions.
There is time, and we thank you for your presentation. Okay, questions from the board?
Sir.
You mentioned the
Ken.
Yeah, Ken. The standalone aspect, and I'm not sure I follow that.
Okay.
How does that affect managed care contracts?
Yeah, great question. We think that we have stressed the single license multi-campus model to its limit. And it doesn't affect managed care contracting and things like that, because in the Florida division, we negotiate all managed care contracts at one time. So when we did United Healthcare, Cigna, Aetna over the past 4 years, we did the whole division at once. So this would be included in that strategy. So if you think about the model we're proposing here, it would be like Florida Hospital Waterman in Eustis, only within the Central Florida market here, which means it'll have to be very tightly integrated with the strategies for the 3-county hospital group.
I was wondering, how much of a full-service hospital do you think we could continue to be in the shadow of all of the assets you have in the Central Florida area?
Thank you for that question, Kathy. I appreciate it. That was the point of the Winter Park example. And if you look at Altamont, Celebration, the way we approach things is we invest in really the full spectrum of acute med surg at any of our campuses, and then we let the market and the physicians and, frankly, the community's needs and some investments, particularly like with Celebration, the Surgical Advancement Institute, to drive even more things above that. So full service community hospital services, and then in our reply, you'll see in the bound report we have for the 19 questions, we view all of the things you asked about as being very important to this campus, and then there's probably a long list of things that should be in consideration above and beyond that.
Well, in particular, labor and delivery and children's services, since you have such expertise in that area downtown, would you see expanding that possibly?
Quite possibly. Again, that'd be something the board here would want to take up, but obviously closure of services and investment and addition of services would be something that would be a board issue here. However, in terms of market strategy, Des, I don't think I would equivocate at all that we definitely would want to see a strong OB and women's service out in this location. Given the market you have and the community you serve, it looks pretty important. To us as a system, we'd have a great interest in that too, being here. Tim?
I've heard lots of stories or what ifs as far as the Adventists and their management and our existing management. Mm-hmm. How do you see that transitioning?
In other words, what happens to the management team
Exactly.
in a merger? Oh yeah. Well, this is it. It's very clear again in our written response. As just occurred out in Tampa, the CEO was retiring, and the remainder of the C-suite is still there with us as the leadership team. And in our written response, we want to affirm, and I'll do that verbally here, the leadership team that's gotten Health Central where it is today. And we see all of them as being a very important part of the future. We have one requirement as a company, and that is that the CEO has to be a Seventh-day Adventist, and we make that clear as well, and that's a process of appointment, and that's important to maintaining the mission. That's something that we work very carefully with. In the case of Dick Lind, when he was retiring in Memorial, Norm Stein in Tampa, we just work through that process. Whatever this board would want to have happen, we'd work through that. But we think the management team's integral, really important to keep. And I'll mention now, I hope that there will be a process where you're going to dive deeper with independent people and ask them what it was like. We've got multiple places. We would encourage you to talk to the medical staff, board members, community members, staff, and say, what was it like to go through a merger with Adventist Health System? We'd love to give you a list, and you can prosecute that on your own. I am remiss, Madam Chair, I did not introduce my team. We just so worried about, I was worried about the clock. But we have Dr. Des Cummings here. He has been with Florida Hospital. I don't want to talk about how many decades.
58 years.
But he's our Chief Corporate Development Officer for Florida Division. Cy Saliba is our Chief Marketing Officer. Eddie Soler is our Chief Financial Officer. And Cheryl Dodds is our Chief Clinical Officer. And Dr. Dave Moorhead is our Chief Medical Officer. So if you have clinical questions, some of the safety issues they talked about, they're ready to talk about that. Nursing team, things that are really important to the product. And Eddie, of course, you know what a CFO likes to talk about. He's good with other things too. Other questions for us?
What could you bring to the campus, or you vision as far as some kind of educational type things, affiliations with residencies and
Yes,
some of what's going on at...
excellent question. Of course, we're playing at a very high level with the UCF Med School, have invested in that, participated in getting that here. And so we would see Health Central as a clinical site, depending on the physician interests and the faculty here. We would develop rotations. I may just ask Dave to say a few things about that relationship. He's been managing our academic model with UCF, and Dave, talk about some of the other ones as well in our residency programs.
Good morning. As Lars said, we are collaborating with Dr. German and the UCF College of Medicine. We will have their students rotating on a number of our campuses. We have added in the last 4 years 4 additional residencies: general surgery, internal medicine, emergency medicine, and we have a submission in for radiology. The potential of having residents and students rotate at Health Central would be absolutely possible.
The other things that I might add we could explore, again, be related to teaching, but also strategic growth. Investments in surgical programs with leadership here, and I would say we should plan to plug this campus into our Nicholson Center for Surgical Advancement. We have literally operative teaching theater in the Orlando campus, Winter Park, Altamont, as well as what you'll eventually see here is the $20 million Nicholson Center for Surgical Advancement at Celebration that's going up. We've already turned dirt on that. That'll be open in a year and a half. So we would see this as a surgical advancement teaching site. One of those things we think Health Central needs to do out here to get to the markets that I think you want to get to, that you're not getting to the penetration as well as you are right now. I mean, that you'd like to improve on that. Bernice?
Any thoughts on developing prevention models that can help reduce the charitable debt and the increased use of the emergency room with folks who can't afford health care?
Thank you. Yes, again, we have a rather unconventional answer in our written response to that tough question that you asked about how does Health Central bear up to the burden of the uninsured over the coming years. We actually go right at it, and we use the term compete for the poor, because nobody competes for the poor. Everybody tries to avoid it. And our mission, which is incredibly inclusive calling to take care of the entire community, says let's go find them and help sort out their issues and help them live better and avoid their needs in the hospital from time to time, such as emergency room recidivism and things like that, where people are leaving the hospital better, but without the ability to stay better. We also have a very robust process in qualifying people for Medicaid and getting them into medical homes that are already in place for Medicaid beneficiaries. We convert about 45% of our uninsured patients in our EDs to Medicaid. And Eddie, I don't know if you want to add anything to that, but that's the process that our patient financial team has developed.
Working hand in glove with the Department for Children and Families.
Right.
Are able to do that.
Did I answer your question? I didn't get into prevention as much as I'd like. Our Children's Health Initiative, the Diabetes Prevention Initiative that we've launched system-wide, our Community Health Impact Council, which you serve on. I appreciate that. Healthy 100. Dr. Mercado.
How strong is your commitment to wellness, trying to prevent us from getting into these horrible disease states that, cost us billions and billions of dollars? Do you envision ever creating like a wellness center or a model for wellness instead of treating the disease at the end of its...
That's the huge dilemma of the healthcare system, especially hospitals that have gone to treating acute disease for the last 100 years, as I described. We have coined a branded concept called Healthy 100, and you'll begin to see that throughout the community. We have put out there for people's imagination, coming from our legacy as a health and wellness organization, the concept of living to a healthy 100. And we're building models, and we've started with ourselves, Florida Hospital, since we have 17,000 employees, and we're not as healthy as we ought to be, and our employees are costing us a lot of money. And we think we should figure that out and demonstrate it ourselves before we start telling the world how to live healthy, and then we haven't figured it out for our own employees. So we're doing that this year. Next year we want to move into companies and help, like Orange County School District and whoever else. I'm not ashamed to say publicly that I think that the healthcare industry has failed at health maintenance in the HMO model, and it's time for us who provide care to figure out how to become the instructors and providers of healthier living. And frankly, we're all invested in this. We don't want to be building buildings and chasing disease the rest of our working lives. We want to drive down the demand for that and make more intelligent choices about what we spend our GDP on, rather than 18, 20, 24% of GDP on health and healthcare. Thank you.
All right. Thank you so much for the time and care presentation.